Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts. And I'm excited to kick off Season 2 of our podcast series in partnership with Rappahannock Electric Cooperative. It's called We Are REC. Every week we'll release a new episode talking to different people from REC about a host of different topics. We'll get tips for saving money on your electric bill. We'll talk about renewable energy and the impact it can have in our communities. We'll get some behind-the-scenes info about what happens when the power goes out in a storm. Don't miss out on information about community grants, scholarships, REC-hosted events, and more. Get every single episode on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcasts, Google Podcasts, or on Spotify. Just do a quick search for We Are REC. Hello and welcome to The Valley Today. I am your host, Janet Michael. It is Friday as you are listening to the show today. However, we have pre-recorded this conversation with Mark Merrill. He is the CEO at Valley Health. We are meeting on a Thursday morning over the Zoom screen on our respective computers. And Mark, I asked you before we started recording for the radio show if you were happy and a little sad, because I know that your retirement is literally around the corner. And I want to tell you, I'm a little sad because I feel like we've gotten to be fairly good friends from all the conversations we've had in the last month and a half. And you and I have never actually even met in person.
But when the COVID pandemic passed, I'll come down and pay you a visit and indulge myself in some of the beautiful coffee mugs.
That's perfect. I'm marking that down right now. Again, since people are listening to this on Friday, the governor's order, the most recent governor's order went into place that is making masks mandatory. Mask wearing is now mandatory in all public places. And I've got to assume that as the CEO of Valley Health, this is probably something that you're pretty pleased about because it's going to be an important measure to slow down the spread of this virus.
You're absolutely correct. And we were pleased to see issue that executive order. Also appreciated the sensitivity. He communicated that this really is a public health and a safety measure. It is not to be punitive. He does not want to send the highway patrol things, stopping cars on Interstate 95 or 66 for a driver driving down the highway with that on. It is an order for people who are going in public spaces, public transportation, retail, shopping, public venues, courts, public buildings, for getting the driver's license, anything that's in a public space where there is a risk of person-to-person contact, the people are required to wear a mask. And again, it's very important, some confusion that some people have, that they think the mask is going to protect them. The mask, the facial covering, in clinical, we call it universal force control. Because people, as you well know, and as I'm sure your listeners know, the vast majority of transmission of the coronavirus is through airborne particles. And they're coming from patients who are either symptomatic or asymptomatic, which means asymptomatic means they show no signs of being ill, but they could be a carrier and they could be spreading the disease. And it's remarkable how one person can infect a tremendous number. There's a recent case of one choir member infecting 80 people in a church. There was a recent outbreak in South Korea where one person was tracking down 50 people. So it really is to protect the community and people who come in contact with you. If you and I were out in the mall shopping 6 feet apart, if each of us were wearing a mask, we would significantly diminish the risk that either one of us would be transmitting the disease to other people in the community. And that is how we're going to stop the spread.
And I think that's the important thing to note too, because it goes, I feel like in some cases, beyond personal responsibility to really thinking about somebody else other than yourself. And sadly, I feel like we've kind of gotten away from that in the last, 5 or 10 years even, where we're only worried about me. And we really can't do that and be successful in conquering this virus if we're not thinking about our neighbors or even a stranger, like you said, that we walk past in the local mall.
Correct. That's a very good point. I mean, it really is, how do we respond as a community and even as a nation to make sure our population is safe? We watch with horror, a healthcare professional, I watch with horror. The United States is now approaching 100,000 deaths from coronavirus. And you think about when we have rallied as a nation in the past, whether it be during wartime or after the 9/11 terror attack, how we rally as a nation to protect us and serve a common good. And this really has helped common good, because the fewer people who have the disease, the fewer people who come in contact with the disease, the fewer people have the disease, the fewer people will be hospitalized and die. And it really becomes a matter of to me, public accountability and personal accountability. And I appreciate individuals say, well, this is an expression of individual freedom. Well, I've accepted the fact that I'm walking through an airport with a metal detector, and I could say, well, it's my right to carry a knife. Well, no, it's not your right. Your right is to be free to move, but there are risks that can be mitigated, and wearing masks is one way to mitigate the risk, to mitigate the spread of the COVID-19 virus.
One of the examples, Lieutenant Warren Gosnell was my guest on the show yesterday, and one of the examples he gave, and you mentioned this briefly before we started recording, is wearing seatbelts. When they first started saying that seatbelts were going to be mandatory, everybody had, there was a huge eruption. Well, you can't make me put something on. It's my car. I can wear it or not wear it in my car. But it has been proven that seatbelts do save lives. And I think we're at that stage now with masks, just in seeing how bad it could have been and wasn't, because we started implementing the social distancing and the wearing of masks.
No, you're exactly right. And this is a great example that you just gave with regard to seatbelts. I mean, and you think about, what is the objective of the seatbelt? The seatbelt objective is to minimize the risk of harm in the event of a traffic accident. And it's indisputable that seatbelts have saved lives. I mean, that is absolutely categorically an undeniable fact. And I think it's also undeniably a true statement that airbags are saving lives in automobile accidents. And I think we will also learn that it will be an undisputable fact that wearing a facial coverings or a universal source control, wearing masks, will save lives. I can't emphasize enough how important that is, because again, one person being able to infect so many people unknowingly, and if they had a face mask on, there's no doubt in my mind that they would infect fewer people.
You mentioned the study that you had recently read, and I had seen something on one of the national news channels that said, I think it was a story about the contact tracers and the work that they were doing, and what was going into trying to hire so many more of them. And they were talking even larger numbers, because I don't think people realize too, I think their number was one person could potentially infect up to 59,000 people. And I'm guessing that's in the major metro cities, but if I come into contact with you, I have no idea how many people you come into contact with, and then how many those people come into contact with. I was telling my husband the other night, it reminds me, I'm going to date myself here, it reminds me of an old TV commercial for shampoo, where they used to do on the screen, and she told two friends, and she told two friends, and it just keeps multiplying. That's really how it works, as scary as it sounds.
You're exactly right. I mean, your high school or college algebra and statistics, you remember permutations and commutations. 2 times 2 times 2 times 2. 2 times 2 is 4, times 2 is 8, times 2 is 16, times 32, times 64, 128, and it goes very quickly. And you're exactly right. It is an amazing, and I guess that's the other reason why mask is one, but then limiting how close you get to people is a second way to create a barrier. And then third is reducing your exposure to large crowds. So again, you think about going to a high school football game or a NCAA basketball game. You've got 23,000 people in there hooting and hollering and screaming and yelling and cheering and jumping up and down. That's a lot of airborne potential. And you could easily see how that could rapidly infect a large number of people. So all these measures, face mask, distancing, limiting the exposure to large crowds, are all means that we can adopt to spread the disease.
Well, let's take a quick break. When we come back, can we talk a little bit about how you're practicing what you preach? You're not just saying, hey, this is what you guys should do, and not doing the same thing internally. Can we talk a little bit about some of the internal measures and some things that you've asked for your staff at Valley Health to also put in place even in their off time?
Absolutely.
All right, we're going to do all of that when we come back. Again, we are having a conversation today on a Thursday morning. You, of course, are listening to this on Friday afternoon. Mark Merrill is on the Zoom screen with me. He is the CEO at Valley Health. I am Janet Michael, and we will be back in just a couple of minutes. Expecting to hear a commercial? That's what this is, sorta. First, I want to thank you for listening to the Valley Today podcast. You're one of thousands who listen to the show this way every month. Sometimes it's because our listeners are busy and they want to listen when it fits their schedule, or it's a guest of the show who want to hear what they sounded like when they were on the radio. We even have a few binge listeners who listen to a week's worth at a time. Can you even imagine? So if you want those people, your potential customers, to hear your message, then this could have been your ad. And the bonus, your commercial isn't restricted to just 30 or 60 seconds. You can take up to 2 minutes to talk to those customers. And there's even the opportunity to be an exclusive sponsor of the Valley Today podcast, which also gets you on-air mentions at the end of every show. If any of this sounds interesting to you, give me a call at the station, 540-635-4121, or send me an email to janet@theriver953.com. You can also find all my contact info by searching for me on theriver953.com. Welcome back to the Valley Today. I am your host, Janet Michael. We are having a Zoom screen conversation today with Mark Merrill. He is the CEO at Valley Health. Again, we are recording this on a Thursday morning. You, of course, are listening to it on a Friday afternoon. And Mark, when we went to break, we had been talking about the importance of wearing masks and the fact that the governor's order, as of the listening day today, is now in place for mandatory mask wearing if you are out in public. And I mentioned that you practice what you preach because you have internal policies and plans in place for all of Valley Health staff, encouraging them and requiring them in some cases to wear masks, right?
That is correct. We adopted a mandatory masking policy about 4 weeks ago, learning that transmission is so much driven by airborne particles that we felt it was safe to have everybody who comes into the hospital, every caregiver who works here and support personnel to wear a mask. We are also requiring patients who are coming in to wear a mask unless they can't. Obviously, if they can't because of a respiratory issue, but we're requiring patients to wear a mask. And then when we're doing the procedures, telephone screening, we're asking them to please shelter at home once they've done their screening to not have exposure, so that when they come in here, they've reduced the risk. So yes, we've been doing that. We also we've encouraged our caregivers to adopt at home what they do in the workplace. So again, if you're wearing a mask in the workplace, we say please, when you're out in public, when you're doing your grocery shopping or doing your medication or getting gas or whatever errands you have to do. Now that dry cleaners have reopened, or you need to get some garden equipment, to start working outside, something healthy and a nice endeavor to do in the springtime in this beautiful part of the country. If you go to Lowe's or Home Depot or Meadows Nursery, whatever the case might be, wear your face mask, because again, you are helping to mitigate the spread. Obviously, we have installed a lot of hand sanitizers throughout the institution. We put additional ones by elevators so that people are constantly reminded to wash their hands, to again, practice social distancing.
And you guys are kind of lucky in a sense because you did that So Helpful campaign several weeks ago, and you were hoping to get 10,000 masks, I think it was, in like 10 days. And that completely blew up. And that's really been helpful for you.
Oh, it's been a tremendous success. And I cannot thank the community on behalf of our caregiving team. I cannot thank the community enough for their support, not just sewing the masks, but donating fabric, collecting boxes, processing them. It's been a remarkable community endeavor. So we received almost 28,000 hand-sewn masks, and I've been able to share those not just with employees, but our board of trustees, some of our key partners, the private physician offices, physicians who practice in Winchester or who are on our campus or not on our campus. Again, being able to share these with other organizations, some of our not-for-profit partners, we've been able to share them with them. So again, it's been a tremendous benefit. Yesterday, you may have read, we had a competition to try to make a little bit of fun, out of a new activity. And so we had a mask contest, and it was held at Winchester Medical Center, and we had 4 judges, Kimberly Sowers, who's the owners of Kimberly's Boutique in downtown Winchester, Mr. Kip Rutherford, who's one of our trustees and with Rutherford and Johnson, Harry Smith, who's with United Bank and a obviously well-known individual in Winchester, and Skip Phillips, the president. They were the judges of the mask contest. We had funniest, classiest, flashiest, most unique. So we had a mask. Our nutrition services department had a mask with all kind of vegetables. One person made a Spider-Man mask, and it was really cute. It's like something to make it fun. So you can think about this as a new fabric that would be a what do you call it? A fashion statement. So someone commented this morning, I have a yellow mask and I wore a yellow tie today. And so, tomorrow I'm going to wear a blue tie, so I'll wear a blue mask. So I'll be color coordinated.
I did mention that yesterday to Lieutenant Godsnell that I have taken the opportunity to get on Etsy and have bought more masks in more different shades of orange with more different patterns on them than ever. And it really is kind of a way to show your individualism in, even if you think, well, I want to be myself, you can be yourself. And there's so many fabrics and so many patterns out there. So yeah. I have to ask, because I know you're a Tar Heels fan, you do own a mask that has the UNC logo or has something on it, don't you?
I've got a couple of light blue masks, Tar Heel blue, but I don't have any to have the logo, but I'm looking for a logo to sew onto my mask. But you're right, I've seen Virginia Tech masks, I've seen a UVA mask. If I see a Duke mask, I almost reach to pull it off, but I realize that wouldn't be safe.
So I mentioned at the top of the show that you are literally around the corner from your retirement. You've been the CEO at Valley Health now for 11 years. That's a really long time to be a CEO of a hospital system the size of Valley Health, isn't it?
It's longer than the average. The tenure for health system CEOs over the last 2 to 3 decades has continued to decrease. It's not unique. There are health system CEOs and hospital CEOs who have served for 20, 30 years. The former CEO of Inova and the current president of Virginia Hospital Center, they've been there a long time. But yeah, it's longer than the average tenure in today's market.
Well, I did a little research and I have a list here of all of the accomplishments that have been made under your tenure. And I got to tell you, as much as some of these are amazing, 3 new hospitals, you've got 1 new hospital under construction in Warren, renovations at some of the other ones, expansions at a few more. But one of the things was created a robust robotics program. And I have talked to several of the doctors that use those robotics in their surgeries. Was that, do you think, one of the coolest things that you put in place during your tenure?
To be honest, Janet, it'd be hard to pick my top 10. But advancing clinical sophistication has been something that's always been something I've been fond of. It's what attracted me to healthcare. The business side of healthcare I enjoy. I like the accounting and the revenue and all that kind of debt financing and stuff like that. But in terms of the core activity that we do, which is taking care of patients, it is exciting to see clinicians who are passionate about their profession, about their particular specialty, support them to be the best they can be in their field and to have contemporary tools to enable them to better take care of patients. And also to help create where our health system, or in my previous health systems, what we call destination services, where people say, that's a place I would go a little bit further to get because of the care and the clinical capabilities that institution has. The robotics has been very exciting.
So how does the transition work? Because I know that the new Mark, because the new CEO, his name is also Mark, I know he has already been hired. Did you play any role in choosing who the new CEO is, or is that something that you kind of take a hands-off approach to?
I was involved. The process, I'm very proud of our board of trustees. To be honest, it's nice to be able to have a smooth transition, as opposed to, hey, Mark, Monday's your last day and we're going to have to fire your replacement. But no, it was a smooth transition. I kept the board, primarily the executive committee, which is 6 members of the board plus myself. The CEO is a member of the executive committee. So the 6 members of the board of trustees and myself, I informed them a couple of years ago what my thinking was going to be in terms of timing of my retirement. And I wanted to be something that they were supportive of. They were very supportive. They said, we would love for you to stay, but if you want to make that decision, we want to support you in that decision. So the executive committee, the head of HR, and I worked out a time frame, and it was a very deliberate process. And my goal was to be able to leave sometime this summer. And so based upon some research that we did with consultants and in search firms. They said it would take most likely take 9 to 12 months to find someone. So it went, I cannot compliment both the board and our head of HR, Elizabeth Savage, who helped manage the process. So I announced a year ago in June, the chairman of the board established a search committee. Liz Savage and I reviewed proposals from 4 different search firms, and we narrowed that down to 2. And then we presented those 2 search firms to the search committee and let the search committee make that decision. I was not on the search committee. I thought it would be better for the independent trustees to be on that committee. So the search committee met with the search consultants over 3 months, and they reviewed over 150 candidates. They then narrowed that list down to 10, and they interviewed 10 people, and that occurred just before Christmas. And then from that 10, the search committee informed the board that they identified 3 lead candidates and an alternate candidate. And so those 3 candidates came in for 2 days of interviews. And then when they came in for those 2 full days, each candidate was here for 2 days, not at the same time, obviously. And so at that point in time, the entire board of trustees, including myself, the management team, our medical staff leadership, our nursing leadership, our quality team, they all got to meet the 3 candidates. Obviously, we asked them to keep it confidential. And then the final decision was made by the board. The offer was extended, and Mark Nance accepted the position, and he had a transition. So it was roughly not quite 60 days, a little bit more than 60 days from the time he accepted to his start date.
I mean, when you guys started this process, we'd never even heard of COVID-19. This coronavirus was not anything that, most of us were even anticipating. And now here's this poor guy coming in. I want to say at the end of it, but I'm afraid that might be too optimistic. So we'll say he's coming in somewhere in the middle to end of it. Do you think that makes it more difficult for you to step away and for him to step in, knowing that this is what we're kind of dealing with right now?
Slightly, but the good news is he has been in town. He found a home. He and his wife bought a place to live. We asked him, required him to be here for more than 2 weeks ahead of time to make sure he quarantined before he started. He and I have been having a very good communication I've been sharing with him information which are in process. Obviously, it's not ideal to be going through a COVID. It's unfortunate for my successor, Mark, that we're in this quarantine period and social distancing, because one of the best things about this job is getting to know your trustees, your medical staff members, your community leaders, your donors, your elected officials. I spent a lot of time my first year getting to know, Tracy Fitzsimmons and President Lloyd Fairfax.
I guess then it would have been Cheryl Thompson Stacy.
Cheryl Thompson Stacy, Kevin Sanzenbacher, the chief of police, getting to know Jill Vogel, our state delegate. At the time, Beverly Sherwood was our state senator, rather. Mm-hmm. Beverly Sherwood was our state delegate, and Clay Athey was a delegate from Front Royal. So just getting out and getting to know people, meeting Shelley Moore Capito, who at that time was the U.S. Congresswoman from West Virginia, who's now a U.S. Senator. Mm-hmm. So getting to know the community, finding out the perspectives of the healthcare system, clearly getting out and meeting people, our colleagues, being able to go to medical staff meetings and nursing meetings and participating in employee health fairs and going to the safety fair. And we had the safety fair in the fall, the health and wellness festival that War Memorial puts on. Being out in the community is a big part of the job. So it's unfortunate that Mark is not going to be able to jump right into that right away, but he'll be able to meet people one-on-one, and then slowly but surely, as restrictions ease, I'm hoping he'll be able to participate in more of the large gatherings.
Well, and you mentioned that he's already kind of settled into our area and has bought a house in Winchester. I had asked you before we started recording, because I know you're a native of Charlotte, if you were going to stay, and I barely got the question out before you answered, absolutely, we're going to stay. So I'm really glad that you and your wife have chosen to stay here in the Shenandoah Valley, even after you retire from Valley Health.
Yes, we've loved this community, the entire region from from Harrisonburg up into West Virginia, into Maryland. It's just an absolutely beautiful part of the country, which was one of the reasons that I was excited when the opportunity presented itself to me. My wife and I had before we moved to Texas, we had lived in Washington for 8.5 years, where both our children were born. And I always loved that city, the fireworks on the 4th of July and the museums and just the pageantry of going to I love running on the mall. I mean, I never bore of that. Just driving into Washington, parking my car and running on the mall and watching, saying, I am running to the Washington Monument. I mean, how cool is that? And so our daughter, I mentioned to you, our daughter lives and works in DC. My wife grew up in a town very similar to Winchester. It's about a small town about 80 miles outside of Chicago called Woodstock, Illinois. And it's the same thing. It's a county seat where the courthouse is. They had a theater and things like that. They didn't have a university, which we're fortunate to have a couple universities between Lord Fairfax, Shenandoah, and others, but Shepherd University close by. So this is just a beautiful part of the country, wonderful people. And I want Mark to be even more successful than I was. And I hope that he has as much fun as I shared with a teammate. I had high expectations when I came here, and they have been eclipsed by what actually has occurred.
I usually end our conversations with tell me something good, but I think that's kind of the best tell me something good that you could give me at the end of this conversation.
It's been wonderful. And meeting people like you, and it is a wonderful, it's interesting, if I may, I mean, when we were in Washington, when I was in Washington for 8 years, what I called my wife called the currency, what was important, and it was political connections, and it was influence, and it was knowledge. In Dallas, it was more financial, big houses, big cars, big boats, big summer homes, things like that. And here it's the community. I mean, this community is so supportive of the residents of this community are so supportive of the community, the volunteerism, the number of not-for-profit agencies that support so many segments of the population, the collaboration that we see between different parts of the community. The Substance Abuse Coalition is just a perfect example of law enforcement, public defender, faith community, healthcare systems, police, treatment centers, all coming together to address the community need. There's just so many of these that you can just point to and say, the community is so important here.
Well, I'm excited that you're staying, because now when this is all over, we will be able to have a coffee, and maybe I'll have you back on the show in 6 months or so, and you can tell me about your golf game and how you're enjoying your retirement.
I'll keep an eye on your show, and also on the health of Valley Health. But we're in a good, we're in a solid position as an organization. I cannot thank the Board of Trustees in particular. The board has been incredibly supportive of the management team and me, and what we have accomplished as a health system has been a collective effort. It is no one person. It's been from the top, from the chairman of the board, to the committee of the board, to the medical staff leadership, to my team, to the frontline employees, to the community. It really has been a shared success, and I hope all people share in the feeling of pride in what we have been able to accomplish and will continue to accomplish under Mark Nance's leadership.
Well, I look forward to having an interview with him, but he's got some big shoes to fill. I'll just say that right up front. Mark, thank you so much, not only just for spending some time with me today and so much time with me over the last couple of weeks, but thank you for your service to our community. And because I know it didn't just stop with Valley Health. I know you've served on boards. You ran the campaign for United Way in 2016, which was a record-breaking year. So thank you for all that you have done for our community. I'm glad to hear that you're going to be staying with us for a little bit longer.
And I'll be able to listen more frequently.
Perfect. I love that even more.
All right. Thank you very much.
We are going to wrap up today's conversation with Mark Merrill. He is the CEO at Valley Health. We have been having our conversation on a Thursday morning over Zoom. Of course, you are listening to this on a Friday afternoon, but no worries. Mark will be back. I will see to it that we get Mark back on a radio show again in the coming months. I hope you get out. Have a great weekend. Don't forget to take your mask with you if you go somewhere, and keep your social distance. Enjoy the weather that I think we're going to have that's going to be somewhat cooperative this weekend. And I will meet you back here on the air a few minutes after noon on Monday.